erectile dysfunction or impotence or ED, you might know the feeling. You really want things to go well. You really want the relationship to be normal, to be smooth, to be the way it should be sexually. And then suddenly there's nothing. What do? Is there hope? Should we just give up? Who do we go see? It's embarrassing. I can't really speak to my doctor. He knows me. I can't really speak to a pharmacist. It's open and public. What's the answer for erectile dysfunction? Yes, there is help. There is a way that we can make this better. There is a way that we can improve things in the bedroom for couples. And it should not be something that is embarrassing, uncomfortable, and just avoid it. Generally, it's something that is very difficult to deal with for most couples because it's so difficult to talk about. It's so difficult to find a solution. So today we are here to talk about this very interesting but very difficult condition and look at some risk factors, look at some ways to treat it, some options, and how common it really is. And to be honest, 50% of 50-year-olds have either had the problem before or they are about to get a problem with erectile dysfunction. So this is really important. It affects most males. As we get older, definitely the incidence will increase. And the main reason is because it's a vascular problem. What does that mean? It's a blood flow problem. Hi, I'm DrLuke, and I'm here to give you some information about erectile dysfunction to help solve your problem, to help solve your embarrassment, and really get a fulfilling relationship with the one you love. So firstly, let's start off by looking at risk factors. The following risk factors are important. Firstly, as I mentioned, age. Around about 30% around the age of 40-45, 50% at age 50, 70% at age 70. So 50% and 70% at age 70. That's just sort of an estimate. Okay. Secondly, we have got a couple of conditions. Diabetes mellitus is an important thing that can cause that. Smoking is a huge problem. And again, because it narrows the arteries and it does have an effect on the vascular blood flow problem. Hypertension, which is high blood pressure. And you can see all of this is blood vessel related. And because it's blood vessel related, it definitely has an effect. Heart disease as a whole. The interesting fact is that the coronary artery around the heart is around about 4 millimeters. The penile artery is around about 2 millimeters. So you'd probably see symptoms of vascular or artery disease first in the penile artery because it's smaller. So to get a situation where there's erectile dysfunction might be an underlying warning sign of cardiovascular problems and coronary artery problems that is already developing and you're not really sure that it's there. You don't even know that it's there. So it's a good thing to get yourself checked by a doctor. Have a look at these things. Have a look at your sugar levels. Remember, smoking is a major risk factor for coronary disease, heart disease, and then obviously also for erectile dysfunction. Hypertension is important. Oops, I forgot the end there. Important to treat as well. It does put a lot of strain on the arteries. It limits the way the arteries will dilate and the blood flow won't happen properly if the blood pressure is not good. So the other thing that's also important to remember is that you can actually have a situation where you're taking medication that can cause erectile dysfunction. So medication is very important to look at. Some of them can be blood pressure medication that can cause erectile dysfunction. Sometimes even cholesterol medication can cause that, and sometimes also antidepressants can play a bit of a role in that. So I think there again, it's important to speak to your doctor so that they can go through your medication and give you an indication what should maybe be changed in your chronic treatment so that it doesn't actually aggravate the problem. Then definitely you can get psychological problems. So where there's a lot of anxiety, where there's stress about performance anxiety, previous history, even history in your childhood, history of abuse, history of things that has happened before that's not been spoken about, can definitely cause symptoms. That's interesting because that's more often a sudden onset, that it can, you know, become a problem. It won't be that gradual. But again, that's very individual, and if it develops, please get help, because it can really be dealt with, and it will mean so much for the relationship, you know, for the partnership, when that is resolved and when that is treated properly. The other thing that we also have to remember is that a surgical history, for instance, if you had prostate surgery, in some cases, if there's nerve damage, or if there was very extensive surgery, it could affect the function and definitely play a role in erectile dysfunction. Okay, next, let's look at treatment. Treatment is very important, and treatment is actually very effective. So number one is to take an oral medication or a pill. That's where we traditionally know about the blue pill. There are quite a few options available, and what the pills do, they improve blood flow through the penile artery, and the way that gets achieved is by dilating or opening up the artery. If the artery is open and proper blood flow can take place, that's what you want. You want good blood flow to fill all those areas so that you can have a normal erection, and the blood doesn't just flow back again, because as soon as the blood flows back and the pressure is not good enough, then the function is going to be gone. So sometimes you might find that it starts off well, and then within a minute or little while, then, you know, just like it all disappears again. And that's because the blood flow cannot be maintained. So that's what we do with the pills. The pills are there to give you better blood flow so that the pressure is good enough. The tablets work slightly differently. Again, they speak to your doctor so that they can tell you how they work. Some work a little bit shorter, some work a little bit longer, and it really is important to know what dose you should use for your situation. If you're a heavy smoker, or if you have diabetes, you might need a higher dose than for someone that, you know, doesn't need such a high dose. In a younger patient with a short-term problem with erectile dysfunction, let's say very young, in their even late 20s or 30s, and something has happened, a traumatic experience, or you know, any memory from the past has happened, and now they have performance anxiety and they struggle, they might just need 1 or 2 treatments, and get the confidence back and know that, you know, everything is going to be okay. So it's important to know that the pills does not work for everybody. The dose has to be adjusted. I would probably say the efficacy of the pill, around about what we see in research, 50 to 60%, will have a very good response for the pill. From a side effect point of view, what can you expect? The pills does give you sort of a flush type feeling. It can also give you a little bit of a headache because of the fact that it dilates the blood vessels. It is safe to use for almost all patients, except maybe the one big exception is where you use medication that called nitrates that you put under your tongue, a spray or a little tablet on your tongue, to dilate your coronary arteries when you get angina. You cannot use any of these pills with those nitrates. That would be the contraindication. Then, you know, in the past there's been other traditional ways of trying to do that. There's a pump mechanism to try and get the blood in. It's sort of temporary. I don't think it's in so much favor anymore. It's very unpractical as well, but it is an option that's there. If a pill does not work, there's also an option of an injection. Now, you might say, injection? There's no way I'm putting a needle in there. Well, in some patients, it's one of the only ways that actually can get a result, and it works well. And it's, you know, so it's a unique option. You need to also discuss that with your doctor and see how practical it would be for you. But it is very effective, and it can get, you know, it can get very good results as well. Then lastly, there's also a surgical option where an implant that is hidden, no one knows that it's there, and that then can be used to cause an erection when needed. Okay, so what to do in summary when that dreaded moment happens and things are just not working the way they should. I think it's really important to communicate properly. I think as a partnership, you should really go to your doctor, speak to them about the problem, and get the basic tests done. The tablets that are available are really effective in many cases. Please don't wait on the problem. Please don't just let it go and cause friction and cause tension in the relationship, and eventually you're not even sure if anything is going to work. I think the quicker the better. You'll get good results, much better than you actually think. So make sure you get help. There's a couple of basic blood tests that can be done. The reason why we would do that, like I said, it's a vascular problem. It's a blood flow problem. So if you smoke, definitely get help to stop smoking. That is a major problem. If you have an underlying diabetes problem, get it treated as soon as possible. If you have a high blood pressure problem, get that treated as soon as possible. You might be on the wrong tablets, you might be on the wrong medication. Make sure your doctor has a look at your medication and see if there's side effects of erectile dysfunction with those medication, and change it. Get something else. There's lots of options available. You can treat your conditions without having the side effects of erectile dysfunction. But I think the good news of the day is that there is hope. There's hope to get this managed. There's hope to get this treated. And there's hope to have a fulfilling sexual relationship with the one you love. Remember, it's because of a lack of knowledge that people perish. Use this knowledge. Share it with someone. Thank you for listening. I enjoyed discussing this topic that is sometimes not talked about often enough, but it's important to do, and it's important to know, and we can get rid of the embarrassment, and we can get rid of unsaid things, and rather get things in the open and get them managed. I'm DrLuke, and as always, stay healthy.